Hello, my name is Ben Gordon. I'm chair of WISE Social Care and Education Project. I'm located in Harlesden. We've been in existence for more than 42 years and we cater for the adults. We run a daycare center specifically for the adults who are homebound and lonely, and it gives them an opportunity to meet with like-minded people, to socialize and to do some activities which will keep them very busy. It also gives the opportunity for the carers to have some me time, because one of the things that happens if you're a carer, you're probably 24 hours a day. And by spending some time at WISE, the clients will be with us while you can perhaps sleep or whatever it is you want to do. The key focus for us is really to offer a service that is wide enough within the community. We focus currently on the elderly, but we want to also bring in the youth in terms of training them. We're mainly volunteer-based in terms of staffing, but what we want to do is to focus on youth development, because that's something that's very lacking, especially in the Harlesden area. Our funds come primarily from Brent Social Services, because they, through the social workers, the clients are actually sent to us. We do an assessment, but what we want to do is to be a little more broader in terms of the direction that Brent is going now, in that they want anyone who is above a certain age who needs some activity will come to our center. But one of the problems that we have, because we're volunteer-based, we do not have the funds for things like transportation. And in the payments that we get from Brent, it does not include transport. So they have to rely on companies like Dial-A-Ride to get them into the area. And it would be good if we can, as part of our future development, have our own transport. I think that's very critical for the elderly. Not only elderly, but those who have mobility problems. They can't get into taxis. If they're at a certain medical condition, if they come into WISE or any of the other adult daycare centers, they have to be accompanied by a social worker. So in having our own transportation and staff to run that, we get rid of that second person. So it makes it much more efficient. The benefits of meeting the funders really is obviously to put our case to you so that you could help us to develop something that is really needed for the community. Looking after the elderly is key to the success of the borough, because the elderly are actually the ones who actually built this place, and now is the time for payback. And what we have found is that government and local authorities have been relying on charities to do that work. It's good that we exist, but I think if we can work with funders to help us to develop the needs of the community, I think that would be a great advantage for the future. Thank you.
Fantastic.
Over the years, we have been working very closely with CVS Brent in terms of training of our staff, looking at opportunities where we could have funding. So funding is one of the things that we've been trained with, as well as business development. More recently, we had the opportunity to change our network to a cloud-based system, taking advantage of the Microsoft program that has been run via CVS Brent. So our next stage really is to develop our network, develop our social media, and with that, I think it's important to employ youth. Youth are really the people that can handle those things. They could work with us, but we need funding for that. If we rely mainly on volunteers, we will not achieve that. So it's very important that we have funds to pay the youth. Currently, we are working with CVS Brent on a very important heritage project. But something we're looking forward to is an even bigger project that will benefit the whole of the community. We're hoping that we'll have funders, not necessarily only through the Heritage Foundation, but also other funders that want to take a part in looking at the history of the community. So we're looking forward to meeting funders that will be able to help us on that. One of the other things that we have been involved in, we work closely with another organization, the West London Rheumatology Association, and their remit is really looking at herbal medicine. And we've been trying to work with, in combination with Cambridge University and Kew Garden to develop a herb garden. And that requires funding, and that requires expertise, which we have to pay for. So I think if we have the funders that are interested in herbal medicine as part of the future,